The difference between cross-sectional studies, longitudinal studies, case control studies, and cohort studies. What are the differences? I'll try to finish it in a few seconds. Let's do it. Cross-sectional study is just like a survey study. We do surveys there and you just check the prevalence. So we call them prevalence studies. What is happening at one point in time? Cross-sectional study, the survey study. Same thing. You do surveys in cross-sectional study and we call it cross-sectional because we look at what is happening at one point in time. You're looking at the prevalence. Now, if you see what is happening in multiple points in time, same thing, multiple surveys at multiple points in time, then you call it a longitudinal study. Simple difference. Now the next thing, case control study. Here you have two populations, cases and controls. Cases have the disease, controls do not have the disease or a separate disease that you are not focusing on. Now you will go into their past by checking their history and see whatever risk factor they had that caused this disease. That's it. This is called case control, the basic concept. Now, the cohort studies are of two types, prospective cohort, retrospective cohort. In prospective cohort, you are going into the future and studying the risk factor and following up and see, will this risk factor cause something? What did this risk factor do? What will happen to the population? And the retrospective cohort is the opposite. You go into the you start when where the disease and the risk factor has already happened. Yes, it has already happened. You go to the population and you just collect the data and you see that, okay, these people had this kind of chemical exposure and how many of them died or had some kind of illness. So it's a kind of a prospective cohort in a reverse fashion. That's it. We will talk about this in more detail in the future.